News with no bias, exposed. News with no exception, exposed. Delivering nothing but the truth. This is Nurse Station, your trusted source for the current news and public affairs. Your news, our business.
Broadcasting live from NURS Newsroom, Cavite. Good afternoon, Philippines. Good afternoon, Cavite. It's a rainy day in this third day of January. This is Jotica Zayin Esmen Chavez, serving you the hottest and the most leading news of the hour. Your news, our business. For the headlines.
New medication for hypertrophic cardiomyopathy tested and proven by the FDA. Recent xenotransplantation research opens door to the critical needed cardiovascular organs.
US FDA cleared shockwave intravascular lithotripsy for treatment of severely calcified coronary artery plaques. Cardiac diseases, have you Medi-Seen? Before we go into our hottest and most leading news, let me introduce you first to the overview of the cardiovascular diseases. These are conditions that affect the structure or function of your heart and your blood vessels. Recently on news that in Philippines, cardiovascular diseases are responsible for a third of death in the Philippines. According to the Philippine Statistics Office, cardiovascular diseases are part of the larger group of non-communicable diseases, which account for 72% of deaths in the country in 2021. However, globally, cardiovascular diseases are the leading cause of death, taking an estimated 17.9 million each year. And remember that people with high blood pressure, high low-density lipoprotein, cholesterol, diabetes, smoking and secondhand smoke exposure, obesity, and having unhealthy diet and physical inactivity may put you at risk. More than 4 out of 5 CVD deaths are due to heart attacks and strokes, and 1/3 of these deaths occur prematurely in people under 70 years of age. So take control. Take care and listen carefully to that heartbeat of yours. This has been your anchor, Jotica Zayin Chavez, reporting your news, our business. Moving on to the new medication for HCM.
Recently, news about hypertrophic cardiomyopathy has been making around once more. HCM is a serious and common genetic heart disorder that is usually caused by pathogenic variant or mutation in sarcomere gene, which lead to heart muscle thickening, and is considered obstructive when it prevents heart from getting and pumping enough oxygen. It has mortality rate below -1 per year. Currently available pharmacological treatment for HCM exists, however it has disease-specific, poorly correlated, and only focus on symptomatic relief. Thus, new medications such as mavacamten have been researched and approved for medical use in order to approve for more effective way to treat HCM on April 2022 by the FDA. This has been Trisha Maiden P. De Los Reyes, and here is Kia Havilinar for more details on mavacamten.
Thank you, Trisha. The medicine mavacamten is a new first-in-class medication that functions as a selective allosteric inhibitor of cardiac-specific myosin adenosine triphosphatase. It inhibits actin-myosin cross-bridging reversibly, reducing excessive heart muscle contraction. Statistics based on a 30-week study shows at 30 weeks, 37% of the patients had a clinical response to mavacamten. 27% of the patients achieved New York Heart Association Class 1 status, which means no limitation to any physical activity. And finally, 65% of the patients in the mavacamten group have improved by at least one class in the NYHA. Certain effects of mavacamten include gradients in the left ventricular outflow tract improving significantly and consistently. The body tolerates it well, it has no detrimental effects on cardiac function, And finally, it opens up the prospect of removing surgery and avoiding stereotactic radiosurgery. This has been Kea Havilinar and Trisha De Los Reyes reporting. Your news, our business.
Recent xenotransplantation research opens door to new supply of critically needed organs. For more information, here's AJ Labajo and Gwyneth Chavez.
Good day everyone, I am AJ, your newscaster, and today I will report about the new update of the xenotransplantation. It reached a successful record for a breakthrough of this year's surgery. It is a process of transplantation of cells, tissues, and organs from another animal species to the potential human recipients. The chronic shortage of the human transplant to treat tissue and organ failure has led to the development of this process. According to some research, we can receive some important hormones and some medicines that pigs produces. First, we have insulin. The pig pancreas is an organ from which insulin is obtained, an essential hormone for diabetics. Next, we have ACTH or adenocorticotropic hormone that is used in human medicine for the treatment of arthritis and inflammatory diseases and can be obtained for the pig's pituitary gland. It also stimulates pig thyroids, which are also used to obtain medicines that will consume by the people with inactive thyroid glands. And also heparin. It is obtained in the intestinal mucosa of the pig, which has anticoagulant properties and is applied in human medicine in the cases of thrombosis. And second to the last is the hemoglobin, which genetically modified pigs that can produce human hemoglobin, a pigment in the blood that carries oxygen to the cells of the body. And last but not the least is the surfactant. It can be used to remove from the pig's lungs. This substance is essential for the treatment of the babies with pulmonary immaturity. And that is all for my news. This is AJ Labajo in Nurse Station. For more important details and recent news, here's Gwyneth and Chavez.
For a number of reasons, pigs are best suited as heart donor animals. Their structural similarities to human hearts compared to non-human primates. Breeding is easier, more affordable, and presents fewer moral dilemmas. Just like what Ms. Labajo said earlier, genetically modified pigs can also produce human hemoglobin, and there's already a history of pig heart valves that are successful in replacing human heart valves. January 7, 2022, a man became the first person to receive a genetically modified pig's heart. The U.S. Food and Drug Administration denied the researchers' request to test the pig hearts on humans during a clinical trial. However, David Bennett, a 57-year-old patient with terminal heart disease, provided Mohiuddin's team the opportunity to proceed right to a human transplant from a genetically modified pig. He received a pig heart after the researchers secured approval from the FDA since he would have perished otherwise. Unfortunately, Mr. Bennett only managed to live for 2 months after the surgery. End-stage heart failure is the condition of Mr. David Bennett. It is the most devastating type of heart failure because this weakens the heart over time, and the human heart cannot pump enough blood to complete the body's essentials. It is a chronic condition, so there is no cure. Management and treatment solutions can help a person cope with the symptoms this condition presents. It also reaches up to 75% mortality rate. They will always experience symptoms even when resting. The signs and symptoms of this disease are difficulty of breathing, fatigue, abdominal pain, sudden unexplained weight loss, irregular heartbeat, and fluid retention. All over the world, it is estimated that 64.3 million people are living with heart failure. This is Gwyneth Chavez reporting, Your News, Our Business.
US FDA cleared shockwave intravascular lithotripsy for treatment of severely calcified coronary artery plaques. Here's Mika Lumyo and Almira Hansinal for the details.
Coronary artery calcification results when plaque, or fats and cholesterol, accumulates in the heart's two main coronary arteries and calcifies or hardens over time. The amount of calcification is an indicator of how bad atherosclerosis may be. Atherosclerosis is the result of plaque collecting in the arteries, making them narrow, stiff, and less able to expand and contract. This makes it difficult for blood to get through, causing patients to experience stable angina, shortness of breath, and being more prone to cardiovascular issues such as heart attack and stroke. Coronary artery calcification also causes difficulty for healthcare providers to perform percutaneous coronary intervention or angioplasty as stents become harder to expand to open the artery. And according to a study, the presence of coronary artery calcification is age and gender dependent. It is present in 90% of men and 67% of women older than the age of 70. Furthermore, diagnosis may be through CT scan or more invasive tests like cardiac intravascular ultrasound and intravascular optical coherence tomography. As for treatment, recommendations depend on the extremity of calcification buildup. Doctors may suggest change of lifestyle for non-severe cases. However, immediate plaques and calcification removals are prescribed, in which one of such treatments is intravascular lithotripsy. Once again, I am Micaela M. Lumio for coronary artery calcification. And further information about this treatment will be explained by Miss Almira.
Thank you, Miss Mika. Intravascular lithotripsy is a novel technology based on an established treatment strategy for renal calculi. Lithotripsy has been used for decades to treat kidney and ureteral stones. However, it is only in 2016 when the U.S. Food and Drug Administration has cleared the shockwave intravascular lithotripsy system for the treatment of severely calcified coronary artery plaques. The device uses a balloon to deliver sonic pressure waves that can pass through soft arterial tissues to preferentially disrupt calcified plaques and optimize stent placement. For a more precise explanation, here's the video about how shockwave IVL system works. Shockwave intravascular lithotripsy system is an update advancement in the coronary arterial calcification treatment system. It consists of a compact rechargeable generator, simple connector cable, and the intuitive catheter in which where the lithotripsy emitters inside the integrated balloon are enclosed. As to how shockwave IVL system is operated, firstly, the catheter is inserted into small incision in patient's arm or leg, which is guided towards the heart or where the lesion is situated using marker bands. The generator produces energy, which is then transferred to the IVL emitters that then produce electric sparks, resulting in the creation of vapor bubbles of the surrounding fluid medium in the integrated balloon. This then results in acoustic sonic pressure waves that fractures the problematic calcium deposits while not causing trauma to the soft arterial tissues as the waves only passes through them. After using shockwave system, the doctor may then implant the stent to keep the vessel open or perform the other preferred treatment strategy. Thus, through shockwave IVL system, trauma is being minimized, there will be optimized outcomes as well as simplified procedures. This has been Mika Lumio and Almira Hansenel reporting. Your news, our business.
This has been Jotica Zain Esmin Chavez. See you again next time for another 30 minutes of NURS Station. News with no bias.